Hello, I'm Kirill, a manual therapist, sports medicine doctor, and specialist in therapeutic physical training and rehabilitation. The topic of today's video is disc herniations. In order to better understand this topic, we need to touch on anatomy. Our spine consists of vertebrae and special cartilaginous structures that are located between them, which in turn are made up of cartilage that surrounds them and a special pulpy nucleus that is located inside. So, a herniated disc is a condition when the cartilage ruptures and the pulpy nucleus comes out. Simultaneously, a severe inflammatory response happens. Also in our spine is the spinal cord. From this spinal cord, there is a special formation called nerve roots. They exit between the vertebrae and then form the nerves of our arms and legs. The problem with a herniated disc is that when the nucleus pulposus comes out, it can mechanically compress the nerve root, and due to the inflammatory reaction, this pressure becomes even worse. What types of disc diseases are there? First of all, there is protrusion. This is a condition when the nucleus pulposus has started to slowly break through the disc, but the ring is still intact. When the ring ruptures, the condition is called a hernia. A sequestrum is a situation when the nucleus pulposus has come out and a separate piece has broken off from the herniated disc. This separate piece is called a sequestrum. To test for the presence of a hernia, special tension tests are used. The main test is the straight leg raise test. To do this, you need to lie on a flat surface, tie a towel to your leg, and slowly, without using muscle strength, begin to lift the healthy leg. Remember your sensations. Normally, the sensations should be somewhere under the knee. Then you need to lift the affected leg to see if you have the same sensations or not. If pain occurs in the lower back or the angle of leg lift is less, and the pain can also spread down the leg, for example, into the calf, then most likely there is a hernia. Another good option for testing for a disc hernia is the so-called slump test. To do this, you need to sit on a high chair, lower your head, round your shoulders, put your hands behind your back, and slowly straighten your healthy leg. Remember the sensation, then lower it and perform the test on the affected side. The sensation on the affected side should be different. You may not be able to straighten your leg and you might feel pain in the lower back, calf, or foot. Other characteristic signs of a herniated disc in the spine include nighttime pain, pain in the calf, in the leg, numbness, and weakness. For example, if you try to walk on your tiptoes when you have an acute and serious herniation, most likely your heel on the affected side will drop down. Or, for example, on the contrary, if you try to walk on your heels, then one leg on the affected side will kind of slap down with the toe. The gold standard for diagnosing a hernia is a magnetic resonance imaging examination, which must be performed on a magnetic resonance imaging scanner with a magnetic field strength of at least 1.5 Tesla. A hernia is clearly visible on a magnetic resonance imaging and you can plan its further management. There are three types of treatment for a disc hernia. First, there is surgical treatment. There are absolute indications for it, meaning situations when surgery is absolutely necessary. And the first indication is numbness in the perineum. The second is dysfunction of the pelvic organs. For example, frequent but ineffective urges to use the bathroom, or on the contrary, incontinence of urine and stool. Another absolute indication for surgery is the progression of neurological symptoms. That is, for example, at first there was pain in the lower back, then the pain started spreading further down through the buttock into the leg, then it went into the foot. Numbness joined the pain, then muscle weakness appeared along with the numbness, and the pain began to spread to the other leg as well. And all this happens even though you are regularly seeing your doctor, following all his recommendations, and yet this process continues. The disadvantages of the surgery include frequent recurrences as well as instability after the operation in the segments adjacent to the operated one, and intraoperative risks. The main advantage of the surgery is the rapid relief from pain. It should also be remembered that with some types of surgery, partial removal of a fragment is performed to provide better access to the hernia. The good news is that a hernia can be treated without surgery. Neither the size of the hernia, nor the presence of a sequestrum, nor the level of pain is a direct indication for surgery. There are two conservative treatment methods. Let's call them the old method and the new method. The main complaint of a patient with a hernia protrusion is pain that is very strongly associated with inflammation. And therefore, the main treatment for a hernia using the old method will be aimed at relieving the patient's pain through the use of anti-inflammatory drugs. Whether it's pills, injections, or medication blocks in the spine with a strong hormonal anti-inflammatory agent, the advantages of the old method include fairly rapid pain relief. The main distinguishing feature of the new method is that we look at inflammation in a completely different way. Inflammation is the force that can help us reduce the size of a hernia and in some cases even eliminate it completely. To do this, we will stimulate it and not interfere with our body doing its job. When inflammation occurs, special cells called macrophages appear at the side and they will physically consume our hernia and reduce its size. We also need time for the hernia opening to close and for the disc to heal. That's why we use modern physiotherapeutic methods that will speed up these reactions and also help relieve the patient's pain. The course of treatment using the new method is structured approximately as follows. The patient comes to see the doctor with the recent magnetic resonance imaging, which was done no more than a month ago. And together with the doctor, an assessment is made of the likelihood of reducing the hernia and the feasibility of undergoing the new method. If there is a likelihood of reducing the hernia, then the course will include about 10 procedures with a frequency of 3 to 5 times a week. This course will use modern physiotherapy equipment such as various types of lasers with different power and intensity and a high-intensity magnet. Acupuncture, reflexotherapy, special massage, and medications aimed at stimulating the reduction of the hernia and boosting our immune system so that it can complete the process of hernia reduction and disc tissue healing as quickly as possible after completing the course of stimulation and treatment using the new method. The person is given recommendations regarding their physical activity regimen. And after 3 months, a repeat magnetic resonance imaging is performed, based on the results of which a decision is made about undergoing another course of stimulation, or a rehabilitation program is developed, which will be aimed at strengthening the muscles to prevent possible relapses. For those unable to undergo stimulation treatment, I have some recommendations to offer. Rest assured, our immune system does all the work to reduce the hernia. It's crucial not to disrupt this natural process. Therefore, try not to use anti-inflammatory drugs for pain relief. Do not use medicinal blockades. Maintain a protective regimen for your lower back and try to move it as little as possible because a herniated disc is, in fact, a fracture of the disc. And for a fracture, immobilization is extremely important. Use a lumbar corset. Try to sit as little as possible. When you do sit, use a lumbar roll. Also, a very important recommendation during the acute period of a herniated disc is walking. Try to walk as much as possible. If walking is painful for you, then try to walk in such a way. Walk until you start to feel pain. Sit, rest, and keep walking. Try to increase the amount of walking to 10,000 steps a day. Also, try to find a doctor in your city who can help you choose a pain relief therapy that is not from the group of anti-inflammatory drugs. Also, I do not recommend doing intense back strengthening exercises during the acute and subacute period of a hernia. The blood supply to the disc is quite poor and it takes a considerable amount of time, about 3 to 4 months. Also, to relieve leg pain, you can watch the previous videos that were on the channel. We'll leave their link in the description. That's all from me. Good luck to everyone and goodbye.